Hello everybody, Dr. Zemer here with Optimum Wellness. We are the DMV's mobile chiropractors. I am here to debunk a myth or two. The one that we will be talking about today is chiropractors only treat back pain, which is very untrue. During school, obviously a lot of our training is focused on the spine or the back, but we are also trained to treat every joint in the human body. So whether that's your shoulder, your elbow, your knee, we are trained to help treat pain in those areas as well.
What's going on, everyone? Dr. Josh Angulo here, and I'm going to take a second today to talk about one of the 5 myths in chiropractic that we hear a lot as chiropractors that aren't necessarily true. And the number one thing that I always hear people say is, oh my gosh, doc, you're cracking my bones, you're popping my bones. Well, actually, that's not really what's going on. So when a chiropractor goes to deliver an adjustment or a manipulation, as they're sometimes called, what really happens is the joint structures are moving across each other in such a way that it actually creates a release of gas inside the joint itself. That release of gas is known as a cavitation. That cavitation is the sound that you hear, that little popping sound, that little cracking sound. I promise you, it is not the sounds of your bones cracking. That is one of the biggest myths that chiropractors hear all the time. It's actually a cavitation. I want to take a second to debunk a myth that is out there around the chiropractic profession and the chiropractic field. That myth is that chiropractic adjustments are dangerous. Well, actually, that's not the case. There are several studies out there displaying and showing that chiropractic manipulations or adjustments are some of the safest procedures that can be done in the medical field. There's been studies that compare them to many other types of medicine, including pharmaceutical care and other types of manual medicine, and chiropractic adjustments time and time again show that they're one of the safest methods of medicine that is out there. It's a super safe technique. Of course, there are always contraindications to care. If there is some condition that you may have, or there's something that happened in the past, or maybe even an acute injury, there's of course times where there's going to be a contraindication, or basically a fancy word for we don't necessarily want to adjust you at this time. But overall, chiropractic adjustments are one of the safest things out there. Today, I'm going to spend some time debunking a myth that is out there. And that myth is that chiropractors are not real doctors. Well, this is something sadly that we hear quite often. Chiropractors are in fact real doctors. We have to go through medical training that is quite similar to a medical school that your traditional medical doctor would go to. It can be 3 to 4 years depending on the school that you go to. We also have to pass board examinations. Now, this is also kind of variable. At a minimum, you have to pass 4 board examinations that are nationwide board exams to be able to practice chiropractic medicine. And sometimes you have to take a 5th. Now, depending on the state that you practice in, you might also have to take some licensing exams through the state. You might also have to take some jurisprudence examinations, and amongst many other things that you might have to do to be able to be, a board certified and state certified chiropractor. So these are just some of the things that we have to do from an examination level and a certification level just to be able to practice. Now, while we're in school, we spend a lot of time learning all sorts of things. We learn all the ologies, as we say. We learn and have classes in biology, biochemistry, in pathophysiology, and clinical pathology, and skeletal radiology, all of the different types of medicine and sciences that we need to be trained in. And obviously, we also get a lot of training in techniques and methods and how to administer proper exercise treatment for our clients, how to be able to administer chiropractic adjustments. These are all things that we learn about in school, and when we graduate, we are considered doctors of chiropractic. So doctors of chiropractic means that chiropractors are in fact doctors.